I'm working as a chief physician at the UKK Institute. It's a private foundation. Focus of our work is in prevention of home and leisure injuries. Greatest challenges are in prevention of accidental and suicidal deaths in adolescents, 13 to 19-year-old girls and boys, and in adult men. But fatal injuries in these groups are not developing so positively. The problem is that these target groups are very challenging because behind these injuries and deaths, there are often deep problems that are part of our modern society, like breaking up the families and unemployment, and especially young adults become easily drop out from the society and labor market. And these are clearly the injury risk factors.
I am Tatiana Alves. I work for the epidemiology department of the National Institute of Health, Dr. Ricardo Jorge, in Lisbon, Portugal. In Portugal, we have a national accident prevention program in line with the National Health Plan. But it is not part of the list of the priority programs. In this National Accident Prevention Program, home and leisure accidents occupy a relevant position when we're talking about falls in elderly, burns, poisoning, drowning in children, and all type of mechanism of injury at school. These vulnerable groups, the youngest and the oldest, are the most frequent victims of home and leisure accidents.
My name is Stefan Sigrist, and I'm the head of a Swiss institute called KFV, that is Swiss Council for Injury Prevention. The forthcoming years in all fields, I believe that child safety is an issue. Switzerland is not performing very well when you compare the numbers to other countries, for example. And so we have to do more, also talk to parents and so on. We forgot a little bit the main streets in urban areas, which is in villages and in cities. We have 2/3 of all severe injuries happening on these kind of roads.
My name is Birgit Blatter. I'm head of the Department of Monitoring and Research at the Consumer Safety Institute in Amsterdam, the Netherlands. And this institute in Dutch is called Veiligheid NL. And our mission is injury prevention. I think there are many challenges in all areas, but well, to pick one, because of the aging of the population, I think falls prevention in elderly is really one of the challenges we're working on. And of course, we're happy that the ministry also recognizes this now. It's very difficult. It's meeting these challenges needs a deep breath. There's no quick fix. You always have to have collaboration of different kinds of professionals, different kinds of stakeholders. They are acting within their own institutes with their own regulations, guidelines, legislation.
My name is Stefanie Merzhäuser. I'm a pediatric surgeon, and one of my hobbies has been for the last 20 years to promote injury prevention in Germany.
We have focused more on safety in the home since Corona because we learned that intentional injury has increased massively. One of the major challenges of injury prevention is that new parents are born every day. So it never ends. Repeating never ends. The focus has to be on the toddlers, on the small children, 0 to 5, 0 to 6, because that's the most vulnerable age group. And we do really have to look at into those children and their the way they live, the way they are.
is Maria Markovic, and I'm a medical doctor. I'm a specialist in public health, currently working in the Center for Health Promotion in Institute of Public Health of Belgrade, Serbia. When we speak about the current biggest challenges for accident prevention in home and leisure activities, I think that we should make focus on three categories, especially on children, on elderly, and as well on people with disabilities, and especially on in these three categories in domestic surroundings. Also, falls prevention is something that we should have to focus on. For example, in our country, we are really trying to keep up with the new technologies, with the knowledge, but we have to put much more effort on national and I think also on international level to give a proper response on the real epidemic of the falls, especially in elderly, because we are across the Europe, we are aging population.